I think the other piece that I just want to add to this puzzle when we're talking about this population of children with complex needs, co-occurring autism, intellectual disability, and or behavioral health needs, the other place that we see an impact is in educational placements, right? Because we have not really built an adequate capacity to provide for kids with those needs in our state. And so many children are sent out of state for residential educational programs because we don't have what they need here. And we, actually I think Tom Kosker is here, we jointly recently released a report about children sent to out-of-state special education placements, and in the 3-year period that we looked at, there were 224 children who were sent to out-of-state placements for special education needs. And I think, not all of them are very specifically this group, but some of them are. And that places them at great risk because we don't have the oversight for those kids that we need. Our laws in Connecticut don't apply to them. And so there are a host of issues with doing that. And I bring it up because when we talk about capacity in our mental health and behavioral health system, there are also children in our educational system that need access to those services and at times are outplaced because they can't get access, placed out of state because they can't get access here, and sometimes placed in higher levels of care, because we don't have the community-based services. So I just want to highlight that because I think that capacity building, really, we need to be thinking about all of our kids and how we meet their needs here in Connecticut.
I appreciate that. This has been such an amazing discussion. I could do this for a lot longer, but I know we have to go. You're like, this is good. But I would like to say, I think that's very true. There's so many people going out of state, and we don't know that it's safer or better. And I question what actually happens. There's sometimes you go and they're amazing results, and sometimes not. I think that's something we need to look at. If anything, we would want to have such an amazing set of models and options to Connecticut that maybe if people had to have other places to go, that would be it. The one place that we do have more for girls than for boys, as we're working on disordered eating and that is an area where we have very few resources, and particularly when you look at the male population, we don't have many, and we have private equity firms that we're trusting when you're your most desperate time and place. So I think when we look at what we're talking about in general is looking at what someone said here, more nuanced options. And it's okay that as things change and we make different decisions, it's moving as the times move, as we're learning more, leaning into it and trying to discover ways to best support children. And I think trends and times have changed. I'd love to have another discussion because there's still more layers to this, like, the SFIT, when you talk about some of these other models. I think it would be very educational for us to learn about the different other options that might be out there and what these things look like. I love, Dr. Taylor, when you talked about what it looks like to actually be the child, but also the complication. Going back into the home is really, really, really difficult under the best of circumstances. And when you're trying to capture, looking at all the different needs that you may have that make it really more complicated in integrating children, there's just so many layers to this conversation. Ultimately, we're all just trying to do what's best for kids, and having this kind of group together to talk about it, I think really highlights it.